In today's video, we're going to be talking about TMS therapy versus ECT. With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So, Doc, tell me, what's the difference?
I can tell you a little bit about this because but I don't do ECT.
Obviously.
Electroconvulsive therapy or electroshock therapy was and still is a method of giving high current and voltage to a patient's skull.
Real fast, what's the movie reference that everyone's going to know?
Everyone remembers like One Flew Over the Cuckoo's Nest with Jack Nicholson, where you're wearing a bite tray and you're anesthetized or you're asleep, and you're really electrocuting the brain.
Yes.
Kind of like when you shock the chest for someone who's got a cardiac arrest, you're doing that to the brain, and you're really causing a larger convulsion, a seizure, and the goal is to kind of reset the brain.
Right.
I always call it's like the Control-Alt-Delete on the computer.
Okay.
It's like a reboot.
Wonderful analogy.
And there's absolute benefit to it. I've not done it as a practice, so I can't really speak further on the details of it, but there's no doubt there are refractory patients with major depression disorder who respond to ECT. In contrast to ECT, TMS was sort of a kinder, gentler form of ECT. When it first came out, it was used in those same patient subsets. Patients that had refractory depression, some that had failed ECT, or wouldn't tolerate ECT and wanted to have a kinder, gentler way of doing this. TMS devices are transcranial, through the skull, magnetic stimulators that give a microcurrent to your cortex. And they use magnetic fields to go through your bone. So the only reason magnetic fields are involved is to get through the bone, because currents don't go through the bone very well unless you turn it way up, like in shock therapy. So a lot of the devices that put microcurrent on your scalp have limited benefit because it can't get through the bone. It dissipates along the scalp. To get through the bone, use magnetic fields. Once it hits the cortex of the brain, it becomes current again.
Gotcha.
Magnetic fields and current are sisters. So at that point, you have microcurrent therapy with the addition of it getting into the area of interest by using magnetic fields. And in those cases, we do neuromodulation. Then we try and tune that cortex and give brain stimulation. So in contrast to standard treatments, personalizing it, PRTMS, allows us to turn down the intensity even lower than standard TMS. So think of ECT, then standard TMS, and now PRTMS being even less intensity. Where we're tuning down to only 2 centimeters versus the 6 centimeters or so of depth of dose you get with standard TMS. So that reduces some of the side effect profile. You reduce the amplitude of the treatment, which is the intensity, reduce the risk of a seizure, risk of headache side effect. It's almost non-existent in personalized RTMS. And that's why we went that direction. I was treating pediatric kids that couldn't tolerate standard TMS. I was sort of forced to start, how can I do this with less intensity and get these kids through treatment? It couldn't be that loud because auditory processing was a problem, and it was too sensitive, and it hurt too much to give kids the standard TMS. PRTMS is hardly sensate. You've had it, and you can hardly feel it, right?
No, it's literally meditating to me.
And that's one of the arguments people had against us for a while was, well, it can't be working, we can't feel it. And I said, no, I can measure it.
That's the best part about it to me.
So
you're sitting there for 30 minutes and you're meditating. I mean, you can hear the machine working, but it's not loud and you don't feel it.
And we're copying that meditative state. So one last thing I'll say is when you go to your calm state, we take that EEG. We're trying to figure out, where does your brain go when you're calm? What's the frequency? We can measure the frequency that you go to in that calm state, and then we copy it. So we're giving you what you're doing already. We're not changing your brain. We're saying, what does Kyle do well right now? Let's amplify what he's doing well and build that wave. And we're taking meditation to a steroid level and putting and saying, when you meditate, here's your frequency, here's more of that frequency.
Here's where you want to be.
We're going to jump right to the end of the equation and give you the frequency you go to when you meditate.
Gotcha.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.